Today I'm going to do my nervous system assessment. First, ask the patient to say what time, place, and person it is. What's the time, sir?
It's 9 a.m.
Okay, where are you?
Your house.
Okay. Let's see, what's your name?
Brooks.
Okay. Now I'll test his memory. What year did you graduate high school? Okay. How's the weather today on this very day?
It's fair outside.
It's fair outside. Okay. Now I'm going to start off testing the cranial nerve, starting out with the first one, which is the olfactory nerve. I'm going to have the patient close his eyes. Okay. Can you breathe out of that one? This one. Okay. I'm going to have you identify a certain smell on each nostril, okay? Keeping your eyes closed. Okay. Can you roughly tell me what that smells like?
Toothpaste.
Toothpaste? That's correct. Okay. And on the other side, what does this smell like to you?
Deodorant.
Deodorant? Okay, you're right. Now I'm going to assess the cranial nerves number 2, 3, 4, and 6, which are the optic, oculomotor, trochlear, and abducens. I'll look at the eye. Can you look at me real quick? Okay. Can you focus on this object right here? Okay. Now focus on this piece of paper. Okay. I don't see any ptosis or nystagmus or anything like that. Can you look to the left? Look to the right? Okay. Now I'm going to test cranial nerve number 5, which is the trigeminal cranial nerve. Have the patient clench his teeth and then touch the temporal muscle. Okay. Can you clench your teeth for me? Okay. And the masseter. Okay. Can you open your mouth for me? Okay. Now I'm going to test the facial cranial nerve, which is number 7. You can have the patient raise his eyebrows. Okay. Can you frown for me? Okay. Can you close your eyes for me? Okay. Where you're closing your eyes, can you try to open them? Okay. Alright. Can you smile? Puff your cheeks out? Okay. Everything looks good. Okay, now I'm going to move on to the cranial nerve number 8, which is acoustic nerve. I'll just whisper something, see if you can hear. What did I say?
Today is Friday.
Okay, that is good. Now moving on to the 9, 10, and 12 cranial nerves. The first one's the glossopharyngeal nerve. And before I move on, I can go back to the 5th one and also have the patient, this is testing for the trigeminal cranial nerve, have the patient close his eyes. I'm going to ask you to identify whether or not this is a sharp or dull object. Dull. Okay. Is this sharper or duller than the last one?
Sharper.
Okay. Good job. You can also, with the 5th cranial nerve, you can open your eyes now. I can test corneal reflex. Okay. Pretty simple to test. Alright. Let's see, moving on now to the 9, 10, and 12 cranial nerves, the glossopharyngeal nerve, which is the first one. And I basically already assessed that. I hear no hoarseness in the voice or anything unusual about that. With the vagus and hypoglossal cranial nerves, I can have the patient stick his tongue out for me. Okay, go ah. indentations in the uvula or anything like that. No deviations in the tongue also. And moving on to the 11th, final cranial nerve I'm going to assess is the spinal accessory cranial nerve, the 11th. Have the patient put my arms right here, have the patient shrug his shoulders. Okay. Okay, you release that arm. Okay. Place my hand right here, have the patient turn his head against my hand. Okay, can you do it the other way? Alright. Everything seems good there. Now I can test the patellar deep tendon reflex. And you can relax and you can put your arms like this. Just squeeze it like this on your chest. Just having this one go the opposite direction. Okay, just relax. Okay, and you just relax it like this. Okay, and this one right here. Okay, I've graded that at a +2, which is normal. And also, I can test the brachioradialis deep tendon. Just have your hand like this on your lap. Okay, do you feel that movement going up? Okay, and also say that's normal as well. When he walked in here, I assessed his gait, but you can stand up for me. Okay, and just walk behind the chair for me. Okay, and walk back. Okay, I don't see any odd movements or anything of that nature. Now I can assess his sensory ability. You can now have the patient close his eyes again. And tell me with your left foot, tell me as soon as I touch your left foot with some object. You can scoot back a little bit so the camera can get you. As soon as I tell you, as soon as I touch your foot, you can say when I've touched it, okay? No? Okay. Also, now, I'm going to ask you to identify whether or not this object is cold or hot, okay? Cold. Okay. Tell me if this object is dull or a sharp object. Dull. How about this one in comparison? Sharp. Okay, I'm going to place an object, either one or two, and you can tell me if there's two objects on your feet. Okay. Two. Alright. No. There's none. Okay, I think that concludes my nervous system assessment.